Hello everyone, my name is Mampane. I'm a dietitian. I'm based in South Africa. I'm practicing in Rustenburg. So today I want us to discuss the microvascular complications in diabetes. When we talk about the microvascular complications, what we are talking about is the complications that affect the small blood vessels in diabetes. So this occurs mainly because of poor glucose control. So we have three main complications that affect your small blood vessels when you're diabetic. It is first your retinopathy, and then we also have neuropathy, and we also have the nephropathy. I know they are big terms, but I'm going to simplify them for you. So when we talk about the diabetic retinopathy, these are the small blood vessels that are located inside your eyes or inside your retina. Retina is the part of your eye that receives the light and transmit the message to the brain. So when the small blood vessels are damaged because of increased blood sugar, what happens is that the small blood vessels get thickened, and when they get thickened, there is a reduced blood flow to your retina. So that reduced blood flow now prompts the retina or the eye to produce small blood vessels just to try and compensate for that reduced blood flow or oxygen into the part of the eye. So those small blood vessels that are formed, they are very small, they are very fragile, and they are susceptible to rupture. So what then happens is that after those small blood vessels rupture, we get what we call vision loss or blindness. So yes, and then how we prevent this retinopathy is, the main thing is to get your sugar well controlled. So what you need to do is that when you do your regular checkups at the doctor, check how your HbA1c is. The HbA1c is normally the test that the doctor does, to check how your sugar has been for the past 3 months. So we want it to at least be less than 7%. So the research has shown that the HbA1c of less than 7% helps to, prevent the occurrence of such complications. So what else that is required for you to prevent vision loss when you are diabetic is that you need to do your annual checkups with your ophthalmologist, your eye specialist, so that the ophthalmologist will help you at least detect if there is any abnormality earlier, and they also help to prevent that vision loss. These three complications that actually the main causes of mortality in our people, our patients that are diabetic, and they are very expensive to treat. So it is always best to prevent them. So the second one, it is the one that affects your kidneys. It is what we call diabetic nephropathy. So this is the damage to the network of your blood vessels that helps to filter your blood. So what happens here is that you get loss of protein through your urine, or loss of large molecules that are not supposed to be excreted through your urine. So this is the a main cause of end-stage kidney failure in our patients that are diabetic. So it doesn't only increase your risk of developing end-stage renal failure, but it also puts you at the risk of cardiovascular complications, because when you lose protein in into your urine, what happens now is that the liver start producing what we call lipoproteins. So it produces more lipoproteins, which are the proteins that helps to transport your fats. So that now causes lots of build-up of fat into your blood vessels, and it can cause your heart attacks and stroke and all of those things. So the third one, it is neuropathy. So these are the damage to the nerves. The nerves are the small fibers that helps to, transmit messages between your brain and different parts of your body. So the nerves, it's either, the ones that can be damaged are the ones that help to regulate your heart and your blood vessel function, or it can be, you know, the nerves that are situated at your extremities. So I want us to start with this one, the peripheral neuropathy. So this one, you're going to start feeling the tingling on your extremities, or there can be form of sensory loss, or also the pain, you know. So that early assessment, either by your doctor or your podiatrist, can help to manage it and, you know, help improve your quality of life. We also have the one that I said, the nerves, they help to regulate your heart and your blood vessel function. So when those nerves get damaged, what we get is that you know, you might start developing this abnormal heart rates, or the feeling of dizziness, or it can also cause, you know, fainting or even falls. Yes, and then yeah, so those are the, you know, we've got that peripheral neuropathy and your cardiovascular autonomic neuropathy. The other one, you know, where we can get the effect on your nerves, it's the ones that are situated at your on your gastrointestinal tract, the ones that help to move your food down the GIT, or the gastrointestinal tract. So when that develops, you're going to start now having this form of bloating or nausea, because absorption, digestion, it's affected. Those nerves are the ones that helps to move the food down your intestine. So when they are affected, that it becomes impaired, and you also now present with symptoms of nausea and vomiting, mostly after eating your food. So main thing, like I said, is prevention. After diagnosis, always check with your doctor. Don't be a kind of a patient who is passive and expect the doctor to do everything for you. Know how your sugar control is, check how your HbA1c is, and also look after other factors that can contribute to the development of these complications. You know, your blood pressure also has to be under control. You need to avoid things like smoking, you know, alcohol, and the other thing as well that you need to keep always under control is your lipids, because that can also increase risk of, you know, development of these complications. So that's all for today. Thank you.